Okay, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. Come in, I want to show you my patient. He has a really nice facial structure, but I want to give him some feature enhancement. I also want to fill out some of this mid-fit central hollowing that he has in his face so that it makes the overall look of his face, especially look, if it's volumized, it's more lifted, so it would look less like there's any scarring or textural irregularity. So we're basically doing full male facial sculpting today. My patient's hearing impaired, so we're not going to be able to get much information from him, but we're going to do some sign language because I want him to tell everybody via sign how he looks when we're done with our MRIzed male facial sculpting. So we're going to start out first and kind of define this lower face. Then we'll work our way up. I'm going to start on his chin and jawline. You see he has a nice chin structure, but based on his facial shape, we really need to go a little wider. So I really want to build this out. And I'm using Restylane Define today because this has some nice structural ability, and this will allow us to really give him that definition that he's kind of looking for. It also would just help lift this part of his face and help the pre-gel and the marionette area. Good. You guys see we're really building this out along the bone. Already, you could see a big difference in structure. Are you sure they gave you the right amount here? It says 2 defined chin, 2 defined jaw.
You're using 1
I only
define,
have
right?
2 total. No, I only have 3. Yeah.
Okay, I'll do 1 more define.
Okay. So now we're going to go to the other side and we're going to really define it out here. Get in close, don't be shy. Our goal is to just make him look more youthful, give him a little bit more definition. And get more of the shaping that he's looking for. So I want to create more of that contour for him. Sorry. Okay, and you can see now, much more wide, much more projected.
Someone said, named Jay says you are a pro with that needle, Doc.
Thank you.
He knows, guys, he knows.
Trying.
Everybody knows.
So where is temple? I'm gonna let that sit a second, and we're gonna work our way now to the temple. And we're gonna do, he doesn't have too much hollowing here. We're gonna build this out a little bit, and I do like to keep the brow elevated, so we're gonna use Lift here. Lift is one of those really high density hyaluronic acids. I really love it because you can see an immediate change in this area. And we'll go all the way down to bone and really get this area to lift. Some people tend to have a little bit more bleeding here because there's veins. So we just hold pressure and we'll switch to the other side. Good. Make sure to don't break them. Now same thing here. You see the ridge here. And we want that ridge to be less noticeable. So we're working now with Lift to really give him some structure. He's doing great. Perfect. A little pressure there. And you can see immediately it lifts the brow. Good. Now I'm going to balance that by, I'm going to lift his head. Just lift your head. There you go. Perfect. By giving him a little bit more definition in his jawline. And so we're gonna come back and use more define, a little more structural to help us get some definition here. can really see that line kind of being built out. We'll need more filler to see a more permanent, bigger change, but this is going to be a nice improvement from what he already had. And sometimes I'll go down the jaw, just kind of build out this whole structure from the side. Good. Now I'm going to do one of my favorite treatments, which is the nasolabial folds. I'm going to have them look up perfect. And we're going to use one of the newest treatments out there called mesh. This is our Miracle Elasti Mesh. What this does is it takes the filler and it inserts it along the length of this fold. And it creates a nice sort of contour here that helps hold the filler in place and lift this area. So I'm going to do a little bit on the fold because that's going to give us structure here. Good. Perfect. That's holding that area in place. Not right now. And then I'm going to fill out a little bit of this mid face here, because some of what he has is just some volume change here that really just needs Good. Okay. Hold there. We're gonna do that same thing now. How's he doing? Good?
He's doing good.
Okay.
I'm teasing him.
On the other side. Again, using that mesh to give support deep. Using Refine here, which is a little bit thinner, more natural of a look. Good. Hold right there. Good. Okay. And then again, we're going to fill in. If you take a look, show that side, Jordan, really quick. Take a look here. Let go here. And you guys can see how much deeper this side is. Watch out. Because we're going to give some more volume through here. This takes a little bit more filler, but this at least will give him a little bit more filled out look. It'll be less hollowing for him. Sorry. Good. All right. Hold right there. Now we're going to work a little mid-face and eye. We're going to focus on going a little under the eye with some Restylane. And again, I'm going to balance this between the eye itself plus sort of giving some volume through the central facial area, because this is going to be the lift that we need him to have.
Somebody's asking why you don't aspirate, Doc.
So, oh gosh, here we go.
Every
So
time.
you
He
guys,
says it every time, guys. It's been proven to not be effective.
it's not effective and help you reduce the risk of complications. I've been saying this now for 15 years, and a recent study came out that validated it, saying that it unfortunately does not help you. I could use cannulas to help limit the risk of complications, but based on my experience in doing fillers for almost 16 years, I'm very comfortable in doing treatment with my technique, and it's not necessary.
Hear that, guys? It is not necessary.
And again, we want him to look better, but not overdone. So we're working. Okay.
I want under eye filler. Send us a DM. We can make that
Yes,
happen.
let's
You're
do
already
it.
on Instagram. Go click that DM button. Send us your name, email, phone number. We'll reach out to you ASAP.
And then the last part is going to be the lips. So we just did a little to the eye. You could see his more structure to his chin. We softened out his mid-facial folds. We lifted his brow. And now we're going to do a little lip. So he has a really nice W shape. I'm using Restylane Silk here. This is a very subtle filler. Sorry, I know. Rub his shoulder a little. But this is gonna give him a little bit enhancement of that W shape. A little softening that looks more natural in a guy. You don't want it overdone. Good. Okay, take a look already at the lower plump. Good. So now, let me lean him back a little. Hold on. We're gonna go to the upper. I like Silk because it's very natural. I'll rub his shoulder a little.
Was Restylane used for the jawline?
Restylane Define was used.
Restylane Define, guys.
Refine for his folds and his mid-face hollow. Silk just lightly superficially for his upper lip because it's a more natural, soft look. Now, the thing about Silk, you guys, is he will swell for 72 hours or so, but it will look really great once the swelling goes down. So let me see. Oh, wow. You need alcohol, Jordan?
What?
Alcohol, please. Cause. So you guys can see. Okay. So we're gonna clean them up a little bit. Just wanna see. Here, relax, relax. You okay? You okay? Relax, relax. What's wrong?
Talk to him with your mask off, dog, so he can enjoy
Are you okay? Okay. Open, open, open. You can't? Okay, hold on. Okay, good. So you guys see now, look. You can see the lip itself. It's okay. So we're gonna keep going here. I'm just gonna fill out this a little bit more. Good. Okay. So now we're done. Let's take a look. I want him to ice just for a second. I want you to take the ice here. Hold here. Perfect. Hold there. Let's clean him. Let's do a little clean. So we're all done. Letting him cool down. The lips hurt a little bit, you guys. Take this down just for 1 sec. 1 sec. And clean. Good. So now if we take a look, you guys. So come in really quick. We built out his chin, got his jawline, softened through here, and improved the temple. So why don't we show him now so he can see. I want him to take a look. Just grab the mirror. Ice again. Ice. Yeah. We'll let him ice a second. I want you to take a look. So We improved through here, lifted here, improved this here, built this out, and then through here I lifted this. So it just looks more sort of shaped. What do you think? He doesn't know yet. Some people don't know right away because there's a lot of swelling and it's hard to see. So this is what I always tell people, 2 weeks to get to the final result. So we'll give him about 2 weeks to take a look. We'll see how much the swelling goes down, and then we'll see, does he like the male facial sculpting? Perfect. All right, ice, hold on. I'll give you this. Ice here, hold this.